Hello and welcome everyone to the first episode of Bright Talks by Pacholi Aesthetics and Wellness. And we are here to discuss and shed some light on the topic that interests all women, PCOS. Yes, and I'm your host Dr. Divya Agarwal, and we have with us our very own Dr. Randhir Dhaliwal, who's the leading gynecologist from Delhi NCR. So let's talk to Dr. Dhaliwal. Namaskar, Doctor.
Hello everyone.
Thank you for joining in. So let's start and deep dive in our first question. But before we do that, I would request all viewers to show us some love by tapping on to the heart button. So doctor, what is PCOS?
PCOS is Polycystic Ovarian Syndrome. Poly means numerous, cyst means fluid-filled sacs, ovary is the location of those fluid-filled sacs. Syndrome is a collection of traits which make a medical condition. So in this case, it is the numerous cysts present in the ovary seen on ultrasound and few symptoms seen in the girl like irregular periods or acne or excessive hair growth. All these put together makes the thing Polycystic Ovarian Syndrome.
That's a bit of mouthful. So we will make it simpler and break it down for you. So doctor, can you please guide us that we have understood PCOS is a condition which is related to the reproductive system of a female, but what actually causes it?
The exact cause of the PCOS still not been pinpointed, but the genetic factors are there, certain environmental factors are there, which leads to the development of a PCOS in a girl. Genetic means it is seen that the mother of the girl might have had her periods irregular, her sisters having irregular periods, or her first cousins are having irregular periods. So there is some familial trait going on. Plus the environmental factor like sedentary lifestyle, and especially post-COVID work from home has led to the increase in the PCOS in the girls.
Okay, so we'll uncover the mystery related to PCOS, but I would request all viewers to keep showering the questions which we will take in the end of the session. So doctor, now since you've said that the exact cause for PCOS is not known, so can you please guide us who all are at risk for PCOS?
Any woman who is in the reproductive age group starting from the menarche to the menopause can develop PCOS anytime in that span of her life because of sedentary lifestyle or the genetic factors which are there, already there with her.
Okay, so are you all wondering whether you are at risk for PCOS or not? So stay tuned with us and continue seeing and watching the video. Okay, so doctor, any women can take the shape of PCOS if they have any kind of a condition. But I would want the viewers to understand when a girl will suspect that she has PCOS.
If the girl starts having irregular periods, that her rhythm was pretty regular, she was getting her periods every month. Suddenly she's skipping a month, they are not there, she starts getting acne which were never there, or her facial hair which were very soft and light colored. Suddenly the number increases, thickness increases, the color becomes darker, more area is getting involved, or she starts losing hair from her crown. Her hair, she's losing hair. So these are the red flags. She should consult the doctor for that. It can be PCOS.
Okay, so that means the early signs are very subtle. So doctor, can you help us to spot them and guide us how the PCOS can be diagnosed properly?
As it is a syndrome, so we have to consider the history also, that she's now her periods are not regular. Physical examination, male pattern of body hair growth, and she's losing hair, she's getting dark patches on her neck or on the skin fold, she's having skin tags, and the ultrasound. That is also helps in diagnosing the PCOS. She might be having multiple cysts in both her ovaries. If these things are there, and out of these three, the history, physical examination and ultrasound, if out of these three, two are present, she is PCOS.
Okay, so now we know that it involves a combination of medical history, physical examination and tests. It's not that complicated as it sounds. So it's essential that the early management should be there. Now let's switch to the interesting question. Can you have PCOS and still have regular periods, doctor?
Yes, as I have already mentioned, Out of the three criteria, if two are fulfilled, she is PCOS. She might be having regular periods as of now, but her tests are showing that her ovaries are having cysts, or there are features of other physical features which are indicating towards PCOS. So yes, a girl can have PCOS with the regular periods.
That means the prevalence of regular period makes the PCOS diagnosis even more trickier. Okay, so now let's understand the prevalence of PCOS. Why, doctor, these days PCOS is so common and prevalent? Please show us some facts about it.
One is awareness. The girls, when they feel they are facing certain medical issues, they Google, they know that this is a medical condition, they should consult a doctor. Plus the increase in the sedentary lifestyle, the change in the food pattern, these are also contributory factors towards the development of PCOS. That is why we feel the prevalence has increased. Maybe it is both awareness and actual increase in the prevalence.
Okay, so we now know that lifestyle factors like diet and exercise, everything can contribute. But the exact reasons of PCOS are still not known to us. So, have you ever feel tired? Do you wonder whether the fatigue that you have is because of PCOS? Is PCOS a culprit for your weakness? So, doctor, is fatigue a symptom for PCOS?
No, fatigue as such on its own is not a feature of PCOS. As a lot of Indian girls, they are low on hemoglobin. That is the commonest cause in our girls, that they feel fatigue. But because they have a PCOS, everything is blamed on PCOS. They might be having some thyroid issues. That can also be the reason of their fatigue. But one should get the investigations done. Once they have a PCOS, there can be other medical conditions also which can lead to certain things in their body. They should not blame everything on PCOS.
So now you know that if you have fatigue, it is not exclusive to PCOS. Yes, it indeed is a symptom, but you don't have to blame PCOS for that. Okay, so doctor, does PCOS go beyond the reproductive system? I mean, if you have PCOS, what other medical conditions or problems you are at risk for?
Yes, the PCOS girls may later on in their life may develop type 2 diabetes. They may have hypertension, they may have heart problems, or they can even have an endometrial carcinoma. So one has to be vigilant throughout their life once they have had PCOS that they are more at risk of developing certain medical conditions than the other women.
Okay, so PCOS can increase the risk of several medical disorders including diabetes and high blood pressure. So doctor, what are other endocrine disorders related to PCOS?
The most common endocrine thing which is seen in the girls with the PCOS is the insulin resistance. Insulin resistance is that their body is producing enough insulin, but the cells, receptors, they are not being able to sense the insulin's presence, and they send the signal back to the pancreas and the brain that the enough insulin is not there. So the more insulin is being produced. So when we check them for the insulin levels in their body, the insulin levels are much more than what it should be. It is not there because it is not being used properly by the body. So we do have a medication to take care of that, which helps in sensitizing the body to the insulin, and the body starts utilizing the insulin.
Okay, so we now know that there are several other medical conditions also associated with PCOD. But doctor, I am sure everyone wants to understand, is there a connection between weight and PCOS?
Oh yes, there is a big connection between weight and PCOS. It is a chicken and egg condition. The weight increases, PCOS increases. PCOS increases, weight increases. So we have to take care of the weight somewhere with the lifestyle modification so that the PCOS gets controlled.
Okay, so we now know that we have to reduce weight, and with the reduced weight, the symptoms of PCOS are also going to reduce. So doctor, does eating pattern also matters, and can you please explain what should be the dietary preference to reduce weight when you have PCOS?
Yes, diet plays a major role in controlling the PCOS, as we have to control the weight. But there is no need to go on a fat diet. One has to eat the proper, balanced, nutritious diet with enough calories in it. And the carbohydrates should be the complex carbohydrates, and there should be enough proteins, as Indian food is deficient on protein. One has to take the optimum amount of proteins to tackle the PCOS. And that helps a lot.
Okay, so a balanced diet with whole foods is the key, and definitely it helps in managing the insulin levels, and that's why it is often recommended to go for low carbohydrate diet. Okay, and no fat diets required, as the doctor rightly says. So remember, the journey can be different for everyone, but definitely there is a possibility of reducing weight. So, doctor, is it difficult for girls with PCOS to reduce weight? I mean, is it really the fact?
Yeah, they do face a difficulty. When their friends with similar efforts are able to lose weight easily, they have to put little extra efforts. And plus, with those efforts, they have to be consistent and patient with their efforts, because it takes them a little longer to lose weight. But they do lose weight. But even if they lose just 5% of their body weight, it helps in controlling their PCOS.
So consistency is the key when you are on your weight loss journey with PCOS. Don't get worried, keep trying, and I'm sure you will reach. So doctor, does PCOS affect skin and hair as well?
Of course, maximum number of times the girls consult us. It is not because of irregular periods. They consult us for the skin problem and the hair problem. They are not much bothered about the irregular periods, but yes, of course, once they start having something on the skin or something is wrong with their hair, they do rush to the doctor and consult.
I'm sure skin is the largest organ and is associated with aesthetics also. So doctor, what are the effects seen on the skin because of PCOS?
On the skin, the commonest thing which is noticed by the girls is the acne. Like the acne which was never there, now they are suddenly having a very bad breakout of acne. They start having a dark patches, velvety patches on their neck and skin folds. They start having skin tags.
Okay.
So that bothers them a lot, and they do consult doctor for all that.
Okay, so skin tag also is associated with PCOS. Do get it checked if you notice any of those signs. So doctor, what are the symptoms on hair one can look for when you have PCOS?
With the PCOS, the girls start having a facial hair growth. Increase in the pigmentation of the hair, the thickness of the hair, and the area involved. They start getting more growth on their chin, upper lip, sideburns, and even on the body hair. The pattern becomes more like a male pattern of body hair growth than what it used to be. Plus, they start losing hair from their head, like it is called androgenic alopecia. They start losing hair from the temple, from the front of near the forehead. So aesthetically it is not good for them, so they do consult the doctor for that. And it is a feature of PCOS.
Okay, so certainly aesthetically it is not good, as you rightly said. So what can be done to reduce the symptoms which you see on skin or on hair? I mean, are there any treatments available which can come for rescue when they are suffering from acne or maybe unwanted hair growth?
Yeah, for skin like acne, there are certain topical applications, some antibiotics. But as the acne is coming because of PCOS, they have to go to a doctor for the treatment of PCOS also. Not just the superficial treatment will help, but yes, that has also to be taken care of, because that will be the first thing they will be saying as a change. Yes, this is getting controlled. For these skin tags, they can be removed with the cautery. For pigmentation patches on the body, they can go for laser, they can go for peels. And for facial hair, excessive growth on the face or on the body, they can go for a laser hair reduction. And for androgenic alopecia, they can go for PRP. But main thing is they have to tackle their PCOS along with all these things.
So now you all know that there are a lot of treatments available which can reduce the hirsutism or the acne which you are suffering from, and you don't have to worry. But simultaneously, as the doctor rightly said, you also have to manage the PCOS, and the correct guidance is important. So now we are having doctor here a lot of questions. I would want to take up one question which somebody has asked. So you've already mentioned about irregular periods, but the person is trying to understand what actually is irregular period. What do you mean by that?
Irregular periods means that the rhythm of the cycle is gone. She was having periods every month. Now she's having less than 8 or less than 8 cycles in a year. That is irregular periods.
Okay. So I hope your query is answered. So we'll take up the next question, which is, what is hirsutism? So doctor, what is hirsutism? The person wants to ask.
Hirsutism is that the girl usually have a very fine, thin, light colored hair on her face and body. But suddenly the number increases, the color starts becoming darker, and it starts becoming thicker. That and the involvement of the more area on the body with the hair, thick coarse hair increases. They start getting hair on the chest, they start getting hair around the nipples, they start getting hair on their necks, they start getting hair on their linea nigra. That is worrisome, and that can be taken care of with the laser hair reduction.
Okay, so someone is asking, doctor, does PCOD affect your sexual life as well? I mean, is there any connection there?
I haven't come across any study so far on this.
Okay, sure, doctor. So we are getting a lot of questions, but we are running short of time. So I would request you all to DM all your questions, and they will all be answered in the chat box. So stay tuned for more episodes on Bright Talks by Pacholi Aesthetics and Wellness. And we are here to break your myths and promote health awareness. As we wrap up, remember, wellness is not a destination, it is a journey. So join us on the next episode with Dr. Arindam Kar on World Heart Day, where the esteemed doctor will be taking up all your queries related to way to your healthy heart. Thank you for joining in. Thank you so much, doctor, for your precious
My
time.
pleasure.